Treatments for wrist pain. Treatment options for wrist pain can vary depending on the cause. Treatment for carpal tunnel syndrome may include 1. Wearing a wrist brace or splint to reduce swelling and ease wrist pain. 2. Applying hot or cold compresses for 10 to 20 minutes at a time. 3. Taking anti-inflammatory or pain-relieving medications, such as ibuprofen or naproxen. 4. Steroid injections. 5. Physical therapy. 6. Having surgery to repair the median nerve, in severe cases. Treatment for gout may consist of 1. Taking an anti-inflammatory medication, such as ibuprofen or naproxen. 2. Drinking lots of water to reduce the concentration of uric acid. 3. Cutting back on high-fat foods and alcohol. 4. Taking medication your doctor prescribes to decrease the uric acid in your body. Treatment for ganglion cysts can include 1. Wearing a splint to keep the wrist from moving. 2. Aspiration, draining the cyst. 3. Surgically removing the cyst. Kienbock's disease is typically treated by 1. Keeping the wrist immobile. 2. Taking pain medication. 3. Surgery to restore blood flow to the wrist. 4. Surgery to even out the length of arm bones. If you have sustained a wrist injury, you can help promote healing by 1. Wearing a wrist splint. 2. Resting your wrist and keeping it elevated. 3. Taking a mild pain reliever, such as ibuprofen or acetaminophen. 4. Placing an ice pack on the affected area for several minutes at a time to reduce the swelling and pain. If you have arthritis, consider visiting a physical therapist. A physical therapist can show you how to do strengthening and stretching exercises that can help your wrist. Diagnosing the cause of wrist pain. Your doctor will perform a physical examination and order certain tests to diagnose the cause of your wrist pain. Your doctor may do the following. 1. Bend your wrist forward for 60 seconds to see if numbness or tingling develops. 2. Tap the area over the median nerve to see if pain occurs. 3. Test the strength of your wrist and fingers. 4. Order X-rays of your wrist to evaluate the bones and joints. 5. Order an electromyography to assess the health of your muscles and nerves. 6. Request a nerve conduction velocity test to check for nerve damage. 7. Order urine and blood tests to detect any underlying medical conditions. 8. Request a small sample of fluid be taken from your joints to check for crystals or calcium. How to prevent wrist pain. Not all wrist pain can be prevented, especially when it comes to arthritis or the development of cysts. However, you can lessen the possibility of developing carpal tunnel syndrome by practicing some of the following strategies. 1. Using an ergonomic keyboard to keep your wrists from bending upward. 2. Resting your hands often while typing or doing similar activities. 3. Working with an occupational therapist to stretch and strengthen your wrists. To help prevent future episodes of gout, consider 1. Drinking more water and less alcohol. 2. Limiting the amount of liver, anchovies, and smoked or pickled fish you eat. 3. Eating only moderate amounts of protein. 4. Taking medication as your doctor prescribed. While it may not be possible to completely prevent arthritis, you can lessen the severity of its symptoms. Trusted source by 1. Reducing stress, when possible. 2. Staying physically active. 3. Working with your doctor on the best way to minimize your pain. 4. Keeping your weight at a moderate level. 5. Protecting your joints by choosing activities that will not overstress them. Exercises to help aching wrists. If your wrists feel sore and achy simply from overworking them, such as working for too long on your computer in one position, You can also do some simple wrist exercises at home to help ease the stiffness and tension. If you've been diagnosed with carpal tunnel or another condition that affects your wrists, talk with your doctor before trying any wrist exercises. Wrist flexes and extensions. This exercise involves placing your forearm on a table, with a cloth padding under your wrist. Turn your arm so your hand is face down. Move your hand up until you feel a gentle stretch. Return it to its original position and repeat. Wrist supination and pronation. Stand with your arm out to the side and your elbow bent at 90 degrees. Rotate your forearm so your hand faces up and then turn it the other way, so your hand is facing down. Wrist deviation. Place your forearm on a table, with your hand hanging off and padding under your wrist. Have your thumb facing up. Move your hand up and down, as if you're waving.